Madam Chair, because it takes about 40 seconds to actually.
Absolutely.
Oh, eek, they can see me.
Absolutely. Yeah, just let me know when Commissioner
I will do that.
Falk and Engen are on.
They are on.
Okay, wonderful.
You have everybody.
Wonderful, perfect. Then wait for that clock to kick to the right minute. We have a computer now that tells us what exactly we're at. Okay. The Grand Forks County Commission meeting will come to order. I believe that all commissioners are present. In the chambers is Commissioner Knopf and Commissioner Rost and myself, Commissioner Peach, and we have Commissioner Falk and Commissioner Engen via phone. And so welcome to everyone. The first thing on our agenda is the approval of the minutes. Does anybody want to make a motion to approve the minutes?
So moved.
Okay, there has been a motion by Commissioner Ross. Is there a second?
I'll second.
Okay, it's been seconded by Commissioner Knopf. All those in favor of the motion signify by saying aye.
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 Opposed, same sign. That motion is carried. The next item on the agenda is the approval of the order, or on the agenda is approval of the order of agenda. Commissioner Knopf, I believe, wanted to add an item.
Yes, Madam Chair, I'd like to add Rich Axvig to
Oh.
the end of the agenda,
To the end.
to the end.
Okay, then we will put that probably at, let's put that at 16. Right 16 BC, and that will be right before the Director of Administration.
Thank you.
Okay, thank you. And with that change to the order of the agenda, assuming a roll call vote, all those in favor.
Madam Chair, we don't have a second.
Oh, we need a second, I'm sorry.
Second, Tom.
Okay, thank you, Mr. Falk. All right, then we have a motion and a second. Approving a roll call vote, all in favor of the motion by saying aye.
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 Opposed, same sign. Then we have that approved to go on to the agenda. And is that for the agenda as well? Or do we have to do the whole change?
That was
the change.
Yep,
Wonderful.
you're good.
Then the next item on the agenda is the approval of the consent agenda. We have bills, overtime, county deeds. We have a couple of beer and liquor licenses and November financial report. Does anybody want anything pulled from the consent agenda? If not, may I have a motion?
Make a motion to approve the consent agenda as presented.
Okay, is there a second?
Second.
Thank you. And any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Item 5 is the Red River Biorefinery. Do we have someone here to speak on that?
Madam Chair, there will be three or four representatives on the line for Red River Biorefinery, including Mr. Swanson, who's representing them. And I believe Mr. Keith Lund is on as well.
Okay, Mr. Swanson, are you on the line?
I am, however, I do not represent this entity. I represent Zipline International.
Oh, my
sorry.
apologies.
Sorry.
That's my fault.
No problem. They'll come up under the planning report.
Hi,
Okay.
this is Steve Park from Ballard. Keshav, are you on? Do you want to explain the project?
Yep, I'm on. Can you guys hear me okay?
Yes.
Yep, so I think you folks may be familiar with our project. We floated bonds through the county in the past. This year, we've been working on getting ourselves fully operational. And we're now at a point where we're producing both hand sanitizer and have just shipped our first few trucks into the fuel market. As such, we've had a challenging year this year with going through our implementation with COVID. As you can imagine, a lot of the world has faced a lot of challenges. And now that we've been putting in some additional financing throughout this year, and as we get to the next year here, we're looking to go back out and do a refinancing of our capital structure now that we're fully operational. So the intention here is to recapitalize the project now that we've taken all the construction risk out and we're an operating entity.
So you're looking at amending the aggregate principal, is that correct, to 120 million?
Yeah, that's right. Sorry, Commissioner Steve. I mean, all this is it's an initial resolution. It's what we call an inducement resolution, and it allows the company to start the clock in case it generates certain costs now that it can be reimbursed with the bond proceeds that will be issued later in 2021. Sorry.
Okay, do I have any questions from commissioners on this? If not, is there anyone who would like to make a motion to change the aggregate principal amount not to exceed $120 million?
Madam Chair, members of the commission, I think the motion would be to grant preliminary approval subject to a public hearing and then set the public hearing date.
Yeah.
Okay.
Yeah, go ahead.
Someone care to make a motion on that?
And what date would we be looking at the public hearing? Would that be the next meeting or in January?
Yeah.
January 7th?
I think we were looking at the first thing we'd have to do is actually publish a TEFRA notice in the newspaper, and then we would do a hearing. The hearing wouldn't be held at the meeting. The hearing can just be held outside. Anyone can hold the hearing on behalf of the county. I think last time Debbie did it, and then the approval of that public hearing would happen at the next meeting. I think we were thinking it would be that, maybe the January, is it 5th? Is it Tuesdays, right?
We've always had the public hearings right here at our meetings before. We've never had it not held at a county commission meeting.
The TEFRA hearing in and of itself, I mean, you can hold it at the meeting. I think last time we did
last time. We did it last time. They did granted approval in 2018.
Okay, yeah, then that's fine. We can do that, and then we would just get the approval kind of simultaneously, I suppose.
Okay, so we need a commissioner to approve the motion, preliminary amount not to exceed 120 million, and then that would follow up with a public hearing to be held on January 7th of 2021. Is that correct?
That's correct.
Okay. Does someone want to
Madam Chair,
Yes.
this is Dave. I'll make that motion combining what you and Debbie said because I don't think I could restate it. But the question I have is, just for the record, this does not have any financial liability for the county, does it?
It does not.
We're just assisting.
That's correct. That's correct.
Okay, so we have a motion. Would someone like to second? It has been seconded by Commissioner Ross. The motion made by Commissioner Engen. Is there any discussion on this motion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Anything else that you need to bring up, Mr. Spark? If not, then I believe we're done with that agenda items. Thank you very much. The next item on the agenda is county board appointments. Ms. Nelson?
Madam Chair, members of the commission, I do have the names of the applicants for the various boards. There are 5 openings and there were 6 applicants for those 5 positions. And I did ask the water board because there was 2 for 1 position that applied, and they recommended William Purdue was their recommendation. The others I did not ask, but there was only 1 person that applied. We will in the future bring back a different format and at a later meeting, and Tom Ford is going to actually take over the process of, first of all, notifying all the members when a term is going to expire, to allow them to apply, advertise for the position, to send back the applicants to the boards, ask for a recommendation that you will have before you make the appointments in the future. But right now we do have these 5 openings and 6 people that have applied, so, with the recommendation for the water board for William Purdue to fill the 1 opening there.
Okay, do we have to do each one separately or can we do them all as one?
We could do them all as one.
Okay, so we have 1 person for the stone board, 1 individual for the safety answer point, 2 individuals for the 1 seat in the water board, and the water board has suggested William Purdue to take that spot. And then we have 2 open for the weed board, and there are 2 individuals' names there. Would someone like to make a motion to approve those individuals? And for water board, it would be William Purdue.
Madam Chair, this is Tom. I would make a motion to appoint Jim Reamer to the Human Service Board, Casey Inman to the Public Service Answering Board, William Purdue to the County Water Board, and Greg McMahon and Robert Leake to the Grand Forks County Weed Board.
Okay, thank you very much. Is there a second to that motion?
I'll second.
Okay, we have a second. Any discussion? If there is no discussion, roll call vote. All those in favor of the motion signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. Yes.
Madam Chair?
Yes.
Because we can hear too much action in the background.
Okay, yes. If any of you that are online listening, please mute your phones or your computers so that we don't hear any additional noise coming through. Thank you very much. If not, then those individuals have now had county board appointments, and I believe that there will be notification made to those individuals, correct?
Correct.
Wonderful. Okay, the next.
Madam Chair?
Yes.
This is Dave. On this topic, I just want to say thanks to Mr. Sondrel, who also looked like a qualified candidate for the water board. And it's good to see people applying. One other thing I think we should consider, and I hate longer meetings, but I think we ought to give people an opportunity to address the commission if they're interested in one of these spots, because it's very hard to make a decision off a 1-page form.
Absolutely. I totally agree with you. We should make it our commission meeting available for them to speak to us. And yes, thank you to everyone who did apply and for those that are taking these positions, because it all of these different committees and boards that we have, it's very important for us to have county representation. And a lot of times they're doing it on their own. So we really appreciate all of those that have been sitting on boards and commissions and will continue to do so. And we do encourage every individual to come forward and have an opportunity to speak to the commission. Thank you very much, Commissioner Engen, for that suggestion. The next item on the agenda is All True Health Systems. Do we have someone from All True Health here to speak with us?
Yes, I'm here. This is Megan Compton. Can you guys hear me okay?
Yes, we do hear you, Megan.
Okay, I am going to try to share my screen so I can just show you some data. Is that all right?
Yes.
All right, let's see if I can get it pulled up here. All right, can you see it okay?
Yes, we can.
Great. So thank you for allowing me to come and just give you guys a brief update on where we're at AllTrue and really how things are going in relation to our COVID response. So I am Megan Compton, the Chief Clinic Operations Officer, and just want to just take a few minutes to give you kind of an update from where we were last time we came to present, and then give you some time if you have questions. I'm happy to answer some of them. Let's see if I can move us here. Okay, so wanted to give a high level overview of really what COVID has looked like year to date. So we really started what I would say is our active response to COVID in March. We had done a fair amount of planning in January and February, but actively initiated our hotline and our curbside testing in March. So since that date, we've taken over 62,000 calls to our COVID hotline, which has been a 24/7 hour service. And at its peak, we were using 10 registered nurses really working that hotline at one time. So when we were seeing a spike in the last few months, late October, early November, we were seeing anywhere between 1,000 and a little over 1,100 calls per day. At the same time, we were testing patients previously we were using our curbside location at our family medicine residency program on the university's campus. And as we started to ramp up in the number of patients we were serving through that curbside testing, we were seeing over 400 patients a day coming for testing. And as the weather changed and trying to manage that patient load became increasingly difficult just with the traffic and the way that location is set up, we moved our curbside location to the Alaris Center. So testing as of right now looks a bit different than when it started. Like I mentioned, we moved it to the Alaris Center. It still requires that someone call the hotline and meet criteria to be tested. But once an individual calls the hotline and really appears to be symptomatic or has been in contact with somebody, meets the criteria in which they would need a test, they can come to the Alaris Center to be tested there. So as I mentioned, at our peak, we were testing roughly 400 patients a day. We've seen a really nice steady decrease in the last 3 to 4 weeks. And yesterday I pulled the data just to get a sense of where we were in comparison. Yesterday, we tested 139 patients at the Alaris Center. So that's good news. I think the work that all of you have done along with the city and in partnership with the institutional partners, we've really seen a nice steady decrease in the number of patients, both in the inpatient side, which I'll talk a little bit more about, and at our curbside location. So one addition is because we've had a change in supplies, we're able to now administer both a COVID influenza dual test at curbside, which is new to us, or at least new in terms of we have the supply to do it. So we'll start doing that this week. And as supplies last, continue to do that. That does give us a chance to test people in a more rapid way. So those test results come back much quicker than what we're seeing with the other tests that are specific to COVID. So that's some good news as well. Hotline data. Again, consistent with some of the other trends that we've seen over the weekend, we took 261 calls. Yesterday, Mondays are always our busy day. We took 215, but again, compared to our peak being closer to 1,100, that's really a significant decrease in what we want to see happening. Inpatient data, I thought I would just share a little bit of, what our historic data has looked like. Last time I was here, I shared a graph. This time, I just want to give you a high level overview of where things seem to be headed. So up until the first week in October, the most that we had seen on the inpatient side of COVID positive patients that we were treating at one time was 10. At our peak, which is about the end of October into early November, we saw at most 46 COVID positive inpatients at one time. Today we're sitting at 17, so again, really moving in the right direction for a variety of different reasons, I think, and we're happy to see that. We had pulled a fair amount of our nursing staff and other support services from our outpatient settings into the inpatient setting to support those nurses, as well as receiving 10 nurses from the DoD, which has been incredibly helpful and really provided some relief for our inpatient team. So with those numbers where they're at, we anticipate that we'll be able to push some of those staff that have transitioned into the inpatient world back out to the outpatient world, but continuing to try to support that inpatient team until we get closer to that 10 number. And then one addition since the last time we were here is we have opened an outpatient infusion center. So this is treatment for patients that were in an inpatient setting, and because of the criteria, meet criteria to allow them to be treated in an outpatient environment. So maybe they start remdesivir, their first doses in the hospital, and they're doing really well and could transition out of the hospital and either go home or go to a next level of care, but they need this treatment. So with the outpatient infusion center, we're able to move patients out of the hospital quicker and make room for new patients and allow them to still be treated. So that's the inpatient transition to outpatient. We're also able to treat patients who, you know, depending upon their symptoms, they may need oxygen and some other things, steroids maybe, and depending upon their symptoms and the criteria, they could be treated on an outpatient basis at our infusion center without having to be admitted into the hospital. So that's good news too, because it keeps our inpatient numbers down. So to date, we've treated about 50 patients, or have gone through about 50 outpatient treatments so far, and continue to be really pleased with how that's working. We have a limited allotment of treatments that we get from the government on a weekly basis. So as long as those allotments continue to come in, we'll be able to continue to increase the number of patients that we're treating on an outpatient basis. And then the sort of big topic the last couple of weeks for us, and probably many of you as well, or at least you've heard about it in the news, is employee data. So I broke it down into two different sections. One is work exclusions, and then what are we going to do about work exclusions? And that is highly dependent upon vaccinations. So at our peak, we were seeing about 200 employees out for COVID-related reasons or exclusions at one time. In fact, at that peak, we had about 50 registered nurses out on quarantine or at home sick with COVID-related symptoms and were not able to work. So we've seen those numbers trend in the right direction and have really come down. Today, we have 39 employees excluded from work because of COVID-related reasons, which is of course not perfect. It's not exactly where we want it, but it's definitely headed in the right direction. So in the meantime, we've also been partnering with the state to plan for our vaccinations to come. So those vaccines for healthcare employees at Altru come this week, and we've gone through and categorized employees using criteria that put really those employees that would be in contact and at the highest risk points in tier 1, and then tiering them out from there. So the employees that are in tier 1 will receive their vaccinations starting this week, and then we will continue to receive allotments from the state over the next couple of weeks. There's two different companies. I'm sure many of you have heard about this. There's two different companies. Pfizer was approved already, and so those vaccinations are on their way. The second company is anticipating approval in the next couple of days, so we anticipate that second allotment to be coming next week. The only reminder, and it's confusing for patients and for the community, we don't vaccinate patients. That's a process that's done through public health. So want to make sure that we're not confusing the community or patients when we talk about vaccinating our employees. So that's really the high level overview, and just wanted to give you an opportunity to ask questions if you have any, and appreciate the time with you guys today.
Thank you very much. Do any of the commissioners have any questions?
I do have a question. Megan, you had mentioned the dual COVID influenza test. Can you tell me more about that? I haven't heard of it.
Yeah, sure. So the question was, I could barely hear you, but I think I got it right. The question was the dual COVID and influenza test. Is that right?
Yes.
Yeah, okay. So there are multiple different tests, and I think Debbie's up right after I am, so she can share too if she'd like to, some of the detail. But there are a lot of different tests that we use to test for COVID. And there are some that do best when they're testing symptomatic patients. There are others that can be done even if a person isn't asymptomatic. It has a lot to do with their viral load. There's also a test that tests, it's a bigger panel, so it tests for both COVID and influenza, which we now have a supply that would allow us to do that with patients that come to our curbside location. So up until now, it really hasn't been a concern, or it hasn't really been a hot topic because we haven't seen influenza within our community. But as we hit that influenza season, we really want to be able to differentiate, or to decipher whether or not a person's symptoms are related to COVID or if they're related to the flu or influenza. So this test, which is a rapid test, will allow us to do that at curbside. So again, we have enough that we believe that if we had a significant amount of patients coming through our curbside location, we could get through several weeks, but don't know for sure because supply is such a volatile experience for health systems right now. It's really hard to predict what that allotment looks like. So we'll continue to offer that to patients that meet criteria where they would really need that dual test. We'll offer it until that test isn't available to us anymore.
Thank you very much.
Yeah.
Are there any other questions of the commissioners for Megan? If not, then thank you very much for the information, and thank you very much to your staff and all of those that are putting themselves on the line. And we're very excited to hear that you'll be getting the vaccine this week to start immunizing your staff. That's wonderful to hear.
Yeah, thank you. As always, we appreciate the partnership and appreciate all the work that you all are doing as well. So thank you.
Thank you very much. You have a good day.
Yeah, you too.
Okay, then we'll move on to public health. Ms. Swanson, are you available?
Madam Chair, sorry to interrupt really quick. I got a text that those on the Zoom are having trouble hearing us.
Oh, okay.
Or maybe your mics aren't on and they need to be closer.
Okay, we will move them up closer, hopefully, and that will make a difference. Thank you very much, Mr. Ford. So public health, Debbie.
Yes, Madam Chair and members of the commission, this is Debbie Swanson. Are you able to hear me?
Yes.
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 Okay. I am starting to share my screen, and I have a brief PowerPoint presentation for you as well about vaccines. So it's a really nice segue from Megan's presentation to this one. I hope I don't give you too much detail here. I did try to make this somewhat high level, but make sure that you're well informed of what's happening on the vaccine front. This is just an example of yesterday's data, the numbers of cases that we had on Monday, because I sent this presentation to you this morning. You can see yesterday was a really low day for cases for Grand Forks County with just 6 and no deaths reported. That number is up a little bit today with 1 death reported in Grand Forks County. So we still very much need the vaccine, and that's what I'm going to focus my presentation on now. As was mentioned, there are vaccines that are available now and have been shipped to North Dakota. The first one is the Pfizer BioNTech vaccine, which received FDA emergency use authorization just last week. And it is now available and has been shipped to North Dakota, and Ultra will be getting a supply of this vaccine to begin. This vaccine is authorized for persons 16 and older. It requires ultra cold storage, and it will have 2 doses 21 days apart. The second vaccine that's in the pipeline is the Moderna vaccine. And this vaccine should be approved for emergency use authorization also this week. It requires frozen storage, but allows for longer refrigeration period. And this vaccine will be 2 doses, 21 days apart. Are you still seeing my slides advancing now?
No, we're just seeing your first slide. It's not being advanced.
Let me try something else. Now are you seeing it?
No.
Oh, okay.
Debbie, do you want me to, I have your slides. Do you want me to try sharing my screen with your slides instead?
I've got it scanned too.
Do you? Okay.
Worked for me yesterday on my Zoom meeting, but it might be the way yours is set up. I did hit the enable button. I will stop sharing, so maybe that will try it one more time.
Are you going to try yours, Debbie?
Yeah, let me try it one more time and see if this works. Are you seeing any slides advance?
No, not at this time.
Okay. Then there must be something in my screen sharing.
What?
I think I might have to have you advance my slides, Debbie. Sorry.
Okay.
The world of technology, we learn to be so flexible.
Yeah, it's great when it works, and when it doesn't, it can be challenging. Okay. Now I'll just have to give you a clue, Debbie, when I want you to advance to the next one. So I did discuss this particular slide already. You can go to the next one. So as I mentioned, these are the 2 vaccines that are now available, the Pfizer and the Moderna, and I gave you the information on the storage and handling for each one of them and the dosages. So you can go to the next slide. These are some of the vaccines that are in development now. You can see there are several more that are coming into the pipeline. 4 of them will be available in 2021, 3 of them in the first quarter. And the Johnson & Johnson vaccine doesn't have a projected date, but it should be available in 2021. And it will be a single-dose vaccine. All of the others will be a 2-dose vaccine. The U.S. chose to invest in several products rather than just one vaccine to ensure that at least one successful candidate came to market. Next slide, please. So what is emergency use authorization? There's the definition of it. It's a mechanism that facilitates the availability and use of medical countermeasures, including vaccines during public health emergencies, like what we are having right now with our COVID-19 pandemic. So there are a lot of things that the manufacturers have to abide by in EUA, just as they do in formal approval, but it allows the product to come to the market more quickly. It doesn't skip any steps, but in our COVID vaccine manufacturing, it has allowed us to overlap some of those steps. And the FDA did require that 2 months of follow-up data was provided for participants who received those 2 doses of vaccine. And I'm sure that has been helpful to people to understand that everyone in the groups for the phase 3 clinical trials has been thoroughly studied. And in fact, we had a couple of individuals from North Dakota that were enrolled that recently did a news article about their experience in it. You can go to the next slide. As I mentioned in the previous slide, steps were streamlined and overlapped, but there weren't any steps that were skipped. And the number of people that were enrolled in the phase 3 clinical trials exceeded those of some of the other approved vaccines. Those would be like childhood vaccines that have been approved within the last 10 or 20 years. Many of them had a much longer time in the FDA process, but they didn't have as large a phase 3 clinical trials. So we know that these have been tested on a large number of people, including people of all ages, adult ages, I should say, and also people who are more at risk of getting COVID disease, so that we know how well the vaccine works in people who might have chronic diseases. The vaccines do not contain a live virus, and they do not interact with DNA, a couple of things that you may have heard through social media. The really important point on this slide is that the known and potential benefits of the vaccine greatly outweigh the known and potential risks of the disease. You can go to the next slide. So our statewide vaccine allocation and distribution looks a little bit like this. There's more than 400 enrolled providers in North Dakota, and there are long-term care facilities that have options for pharmacy partnerships to vaccinate their residents and workers. Some of the long-term care organizations within Grand Forks County will be receiving their own allocation and doing their own vaccinating programs, and some are partnering with pharmacies as well. The federal program that started was just with Walgreens and CVS, but in North Dakota, recognizing that wasn't going to reach all of our rural areas, there are now some local pharmacy partnerships as well. And as was previously mentioned, the North Dakota Department of Health will allocate vaccines weekly, and providers have about 24 hours to accept or decline. We will be receiving some of the supplies that are needed to administer the vaccine. These supplies are provided by the federal government, and then we have used our CARES funding in order to purchase the supplies that won't be available to us through those allocations. Just as an example of how the doses will come to North Dakota in terms of quantities, this week North Dakota is getting 6,825 Pfizer doses, followed by 13,200 Moderna doses if they are approved through the FDA. And then additional doses will come in quantities of 7,800 for Pfizer and 9,700 the following week, and then Moderna with 5,700. So it's not large amounts. The total there through the end of the year is 43,275. But if you consider that we have about 10 to 13,000 long-term care residents and about 68,000 healthcare providers, it won't be enough to vaccinate all. Thus, the allocation of vaccine by those first groups is very important. You can go to the next slide, please, Debbie. These are our partners in planning. On the left side of the screen, you can see there we have a large number of entities that are represented by institutional partners, the health systems, the Air Force Base, the North Dakota Department of Health, pharmacies, UND, and then Wellcore Health, which is a private company that does a lot of vaccinating in schools and businesses. And they will ultimately be busier towards the end of the vaccine campaign. And then on the right side are all of the long-term care organizations that attend meetings, planning meetings with us, and are at the ready to vaccinate their workforce and their residents. You can go to the next slide. Just to give you an idea of some of the logistical and clinical considerations, inventory management is going to be very, very critical to this process, so there's no vaccine wastage. That's going to be very important, and that's where that ultra cold chain storage comes into play. We have that available in Grand Forks at Altru and UND. At Grand Forks Public Health, we expect to receive Moderna vaccine initially, which can be refrigerated, and we will likely be vaccinating as quickly as possible so that we won't need that frozen storage for very long, if at all. However, there may not be enough vaccine for all who wish to be vaccinated, or it might not be accessible in the right place at the right time for people as they're seeking the vaccine. So there will be a tremendous amount of communication that will happen between organizations and the state health department. And also a challenge for providers will be the need to address vaccine hesitancy. We know because this is a new disease, a new vaccine, it was developed more rapidly than in the past. There will be some concerns by the public about the safety and efficacy of the vaccine, and there may be some hesitancy. So providers are working very hard to provide the proper messaging about how well it's working, how it will protect you, how it will really reduce the burden of COVID disease in our society right now. And then one last point I wanted to make is that the vaccine types are not interchangeable for the second doses. So if you get a Pfizer vaccine for your first dose, you have to get a Pfizer vaccine for your second dose. And we do have a bit of grace on that. If inadvertently somebody doesn't have a record and they get the wrong type of product for the second dose, you don't have to revaccinate them. But it will, once again, require a lot of good logistical planning and record keeping to ensure that. Next slide, please. These are the provisional priority groups. The first two are in order of priority. This is the tier 1, healthcare providers and long-term care staff and residents. From there, it moves on to another group of individuals, the essential workers, teachers, and first responders, and then persons with pre-existing health conditions and those over age 65. The last two have had the greatest burden of disease. It's not known whether those individuals, those last two groups, will be next in line in North Dakota, according to our vaccine ethics committee, or if it will be those essential workers, teachers, and first responders that are critical to maintaining infrastructure of our society. So there might be a little bit more information coming out about that as to which direction North Dakota will go. You can go to the next slide. Here's the good news. The Pfizer, BioNTech, and Moderna vaccines are both demonstrating very high efficacy for preventing COVID-19. And in particular, they have prevented severe disease. So very, very few patients or participants in the study have developed severe COVID disease. This is considered a messenger RNA vaccine, and it is new, but the technology has been studied for many years. So while it's a new technology for vaccines, messenger RNA has been used for cancer drugs and other types of therapeutics in the past, and it's been studied for a long time. And also 60% of Americans say they will get the COVID vaccine, according to the Pew Research study. So we know that some individuals have already had COVID, the disease. They may have some protection, but we will still recommend that they get the vaccine. So along with some natural immunity, and if 60 to 70% of Americans get vaccination for COVID, we could be well on our way to developing some herd immunity from this disease. The only contraindication to getting a COVID vaccine is if there are allergies to a component of the vaccine or allergies to other vaccines. Those will be reasons why we would defer vaccination. You may have heard about in Great Britain, they had two healthcare workers that did have an allergic reaction, but they were individuals that fell into that category of having had previous allergic reactions to vaccines. So if you have allergies to foods or pet dander or other things like that, you still could safely get a COVID vaccine. And then the next slide, please. What most people maybe don't want to hear, but what we as public health professionals are going to have to reiterate is that masks, social distancing, hand washing, all of the other public health measures continue to be important while the effectiveness of the vaccination campaign is evaluated. Herd immunity will be achieved, but it may take some time. And so in the meantime, we certainly don't want to transmit the virus, continue to transmit the virus out in the community. So we are going to be wearing masks and social distancing for a while, even in light of having a vaccination. And then my last few slides are just there for your references if you'd like to read up a little bit more on them. On this particular slide, the very last reference, which is the frequently asked questions by the North Dakota Department of Health, is particularly helpful. And it has a great deal of information. Pretty much any question that has been asked is now answered on that FAQ, and it gets updated every week with more information. So that concludes my presentation, and I'd be happy to answer any questions that you may have. And I have one other public health update.
Hey, do any of the commissioners have any questions of Ms. Swanson?
Debbie, this is Mr. Ross. I have a question. Would this COVID vaccine be an annual event as the influenza shot is?
That's a great question, and it's something we don't really know the answer to. I've been hearing reports of, because we only have a couple months of data on immunity. We'll need more months of data to know how long immunity is achieved. And so I would expect we'll get more information about that. I think it's very likely that it could end up being an annual vaccine for a while until the disease is completely suppressed, or it may end up being an annual vaccine like the flu shot. It doesn't appear to have the same ability to mutate that influenza viruses do. So that is also a good piece of news.
Okay, thank you.
Any other questions of any commissioners?
Madam Chair, this is Tom.
Go ahead, Tom.
Thank you. Ms. Swanson, the first thing that I think about is, do you have sufficient staff to, or capacity, I guess, of staff to take care of this vaccination? As I look at it, and I'm not familiar with all the ins and outs of it, but if it's 5,000 a month, and it may run higher than that you get if they get multiple vaccines, you'd have to be vaccinating 200-300 people a day, every day of the month.
Commissioner Falk, members of the commission, we do believe we have enough staff right now to at least to initially start. I think a lot of it will depend on how much vaccine we get, but we have practiced what we call a pod or point of dispensing at the Alara Center and have actually calculated what it would take to get the entire population of the county through in 3 days. So we know we can do large numbers of people if we had all the vaccine at one time, but it will be more burdensome to be doing it every day, every week, on that large scale. I think we've had a really good dry run, so to speak, with all of our testing that we've been doing at UND at the High Performance Center. We might need more resources from the community if we are doing very, very large scale, but we've also added a number of staff that I think will help us. Plus we have a pretty good complement of public health nurses now. Our partners are going to be extremely helpful in helping us get this vaccine into arms. So vaccine is one thing, but vaccination is really what leads to prevention of disease. So we have to get the shots in arms. And we know with our long-term care providers and others that are willing to vaccinate that we should have a pretty successful campaign. But we won't rule out the possibility of needing more resources, like maybe the National Guard shifting from testing to the logistics component of a vaccine campaign.
I'm glad to hear that you have the Alaris involved, because I've heard comments about individuals being concerned about going to a pharmacy because there's not enough space there and that they would be contaminated before they even got a shot. So the Alaris, I think, will relieve people's concerns. Thank you.
Any other questions of any of the other?
I have a question, please.
Yes.
Hi, Ms. Swanson. How are you?
Hello.
I have questions relating to having the COVID shot or the vaccine, who can and who shouldn't. And so I guess I'm talking about or interested in hearing about people that might have AFib, people that have asthma, people that have COPD, that sort of thing. Is it okay for them to get the vaccine?
Madam Chair, yes, there are not contraindications as it relates to health conditions. We did have those circumstances when we had H1N1 flu, and we didn't give it in certain health conditions, but with the COVID vaccine, we don't anticipate that there will be health conditions that would exclude people. There might be some reasons where people with immunosuppression might not have the immune response that we expect, so they wouldn't be protected as easily. But what we're finding is that the vaccine is 95% effective, which really provides us with really great coverage for the population compared to some other vaccines like influenza that has, in some seasons can have as low of effectiveness as 50 or 60%.
Great to hear. One other thing, pregnant women, is there a problem with that?
No, we do not. The vaccine is not approved for pregnant women, nor is it approved for, well, I shouldn't say it's not approved. It hasn't been studied in the clinical trials in pregnant women and children. However, we believe that some of the clinical trials that are continuing may indeed study those populations. But right now, we would defer vaccine unless a pregnant woman, for example, were in another high-risk situation, such as a healthcare provider working in an intensive care unit. In that situation, they'd want to consult with their healthcare provider, and there may be some benefits to vaccinating them.
Great, thank you.
Any other questions of commissioners? Okay, if not, then Debbie, I believe you had one other item to bring up.
I do, and thank you, Madam Chair and members of the Commission, for allowing us to tag on another agenda item to the public health update. This is our safety plan for our initial vaccination clinic that we are planning for the Grand Forks Public Health Department staff, because we will be in the building doing this initial vaccination clinic. And as you know, up until this point, we haven't had staff in our offices except for 1 or 2 people at a time. And this would involve bringing additional staff into our department and very potentially standby individuals. And let me explain standby. If we should happen to open a vial of vaccine and we have no more public health staff, vaccinators that need to be vaccinated, we do not want to waste those remaining doses in that 5-dose vial. So we would quickly identify people in the same tier who could get the vaccine and could come to our department and receive it that day. We have to administer it within 6 hours. We would follow all the normal building protocols, but we did want you to be aware that this will be occurring next week when we receive, if and when we receive our Moderna vaccine.
Yes, and that should not be a problem.
And that's all I have unless you have any other questions.
No, just that this is wonderful news that you're sharing, and the fact that by the end of the year, we could see a few thousand individuals vaccinated in our state. That's great. And knowing that into 2021, we will see quite a few doses being made available, and that's wonderful. It's wonderful news that you're sharing with us. And so I think on behalf of the commission, we're very excited to be kind of turning the corner, even though mask wearing and social distancing will continue. We're excited to see those doses being made available as quickly as possible. So thank you very, very much for that news. Anything else to report, Debbie?
No, thank you very much for the opportunity to present to you.
Yes, thank you very much. Okay, the next item on our agenda is emergency management. Kari, are you online?
Good evening, Commissioner Peach. I am here, but I don't have an update for the board tonight. So you get a break.
Does anybody need Kari for anything? If not, then we will continue on, but thank you very much for checking in with us. It's very much appreciated. Okay, the next item on the agenda is CVIC. Do we have someone from CVIC to share an update with us?
Good afternoon, Madam Commissioner and members of the Commission. Nicoya is here. I'm here.
Okay, great.
Can I go ahead and share?
Yes, please do.
And can everyone see this?
Yes.
Okay, very good. And is it advancing?
Yes, it is.
Okay, very good. Well, I appreciate you letting us sneak into your last agenda here of the year. I just want to start. I have a couple of updates for you.
I'm leaving. That's it.
But I did want to start off with a thank you. As some of you know, I'm relatively still, by Grand Forks standards, I'm still pretty new to the area. Been here about 18 months and have been incredibly just humbled by the spirit of this community and just how blessed we are. We have something special out here, especially in our world of domestic violence and sexual assault. We're very, very fortunate. So I just want to start off by saying thank you for enabling us to provide a holistic approach to ending violence. So I thought I'd share a couple of things of what's going well. We have been talking, just like most organizations in the area and agencies, all things COVID, pivoting left, pivoting right, up and down and all around. And I did want to talk about a couple of things that aren't COVID related as well, because there has been a lot of silver linings in this challenge that we've had throughout most of the year. And then I'll talk a little bit about COVID and then a couple of things that we are exploring for future. They're not nearly a full-fledged business plan or even close to that, even an executive summary, but we do have some ideas that we're looking at as we look toward the future and some learnings we've had throughout the past 8 or 9 months. So on the operations side, we've been very fortunate through the support of many of our partners and donors. We have been able to continue serving. We have not closed the agency. Probably the last 3 weeks has been the most disruptive. Our front desk has been incredibly impacted by COVID as well as some other health issues. So we are in an appointment only status for the next couple of weeks, but we're hoping to staff back up by early January. So we've been very fortunate, and I'll talk a little bit about what we have adjusted through the pandemic. And we're also fortunate through our holistic approach has really opened some doors for us, primarily on that prevention side, which, as many of you know, we're very passionate about. Not only is it quite a bit cheaper to do prevention, but it also helps everyone get involved in a very big problem of violence intervention and prevention. And through our partnership with Gate City Bank, we have been able to educate over 30 trainers in our Green Dot program, which is a bystander intervention program. It's been a really good aspect of our education component throughout the past year. It's a program that's a little over a year old now. And then we continue to survey students that go through our education program. A lot of that has been virtual throughout the past 9 months, but youth who are surveyed following their training are indicating, 96% of them are indicating that they could identify signs and symptoms of violence or abuse. And what we're hearing anecdotally from coaches is that they're also calling each other out on behavior that's inappropriate. So I think it's a really good sign if they're tagging each other on things, that it's definitely working. We've also had a lot of success with our coordinated community response program. Part of that is we look at 2 years of data following those who go through our offender education program and graduate after the 27 weeks. We look at data for 2 years following that and 911 calls with these graduates. And last year that was 68%, and this year it's 74% reduction in 911 calls. So definitely some progress there. On a bit of a personal note, we've also had a marked focus on leadership development and culture. Our industry is known for turnover to begin with social service being a tough spot for turnover. It was well over 30% in 2019. and we were nipping at the heels of 11% about a month ago. I hear from my HR colleagues that I do have to give COVID a little credit for that, but I'd like to think that our focus internally is helping that as well. We've also taken a hard look at our budget process and looked beyond just the upcoming year, but a 3-year projection. That's really helped us with our Safer Tomorrows roadmap. As many of you know, we are looking at a long-range strategic plan to virtually end violence. And so a 3-year projection of what kind of dollars are going to be needed to move those needles on violence intervention and prevention has been very helpful. We're also pretty proud that we had a very good, strong audit this year as well. The CARES Act in funding, as well as some private, what I'm calling grace from a few private funders who were able to provide a supplement due to COVID, has provided a little temporary relief. As I look out beyond 2021, I think we're going to be up against some challenges, but I'm definitely grateful for that, primarily the PPP grant that came through the SBA, and we should hear in a couple of weeks what portion of that will be forgiven. On the social service side, we really have been focusing on how we can elevate our leadership within the industry. We celebrated our 40th anniversary in August, and it's hard to believe it's been 4 decades, and the county has been a part of that for well over half of that life. So we're very, very grateful to that again. We also, as some of you know, because you're featured in it, we are publishing a book called 2 Generation Guardians. It kind of started as an anniversary project, and the more we thought about it, the more we realized it's as much a CDIC story, it's actually a Grand Forks County story. There's a number of folks in the book who have been pivotal in getting us to where we are and will probably be instrumental in getting us to the next 40 years. So we did delay the distribution a bit due to COVID and some other priorities, but we're looking at a first quarter distribution on that. And it's sort of a chicken soup for the soul format. It's something you can pick up and put down. And I'm hoping that this will also provide a great opportunity for us to thank our partners and donors for what they've done for us throughout the past 40 years. We also have had a number of board appointments come through the past several months. I'm pretty proud of this last bullet point. This is Sheila Morris, and our Director of Visitation and Exchange. She was appointed to an international board. She went through a pretty hefty interview process for that. It was almost like a job interview. I had to provide a reference for her, so I'm pretty proud of that. She's been with us for going on 20 years now, so pretty excited about that. We also provided a number of national and international presentations. I think I mentioned to you in April that Carrie Kerr, our Vice President of Prevention and Violence Intervention, participated in an international program where she trained. She needed an interpreter to do this, and this actually happened in January, right before COVID. She and Brittany also provided to a national audience of about 100 via Zoom on the Consolidated Youth Program. We presented at the Charleston Child Trauma Conference, and then we've been a part of a couple of publications as well as contributing writers. And this last one has been very interesting. We 3 of our senior team has been trained in empathic fatigue, or compassion fatigue, as some of you know it. This is a very real part of our CDIC family, and so this is something that where those of us in social services, even if we're on the ancillary level, it's really important that we take care of each other so we can take care of our clients. So that's something that's been really a success for this past year as well. And as we know better than anyone, violence does not stop for COVID, and it's never been more apparent than it has been the past 9 months. I will tell you very humbly, we're seeing some of the most compressed violence and complex issues that we've seen probably in most of our history. Unfortunately, more trips to the emergency department, not necessarily more cases and clients, although we have seen a slight uptick in a couple of different areas to the tune of 11% with sexual assaults, but compressed violence. So people coming in with more severe violence and more emotional and psychological abuse, really tough stuff, withholding hand sanitizer and just really humbling issues. as well as poverty and homelessness. Some of the most basic needs are, we had a group of donors come through, I think it was late July, mid-July, with an emergency fund, and had a number of people contribute to that. And this was things for covering, rent, a little bit of groceries, gas, like emergency immediate needs. And it was depleted by October. So it's definitely a very real problem. What we're grateful for is that we have been able to continue the services. We were one of the first in the state to move forward with telehealth. We've done quite a bit with webcams and different resources to be able to continue our services. Most recently, we implemented a Zoom room for our clients that were not comfortable wearing a mask. Of course, with us, in our industry, it's always a little tricky because we're trying to be socially and health conscious, but also conscious of the emotional challenges as well of those who are coming in to see us. Our shelter stays are also up by 35% over last year. So it's definitely been a challenge. A couple things that we're looking at as we look ahead, we have seen a bit of a silver lining in a couple of areas. We want to continue to position ourselves both regionally and nationally. We also think there's an opportunity as we look at some of the experience around the table. Just as an example, on our senior team, between Carrie, Teresa, and Laura, the three I mentioned that were now compassion fatigue trained, they have about 60 years of experience on them. So we think there's an opportunity through not only their leadership, but also their teams. There's a variety of topics we could train on. And with the world moving to Zoom, I will tell you at CVIC, our board attendance has been one of the best it's been since we moved to Zoom. It's just easier to be on time and not worry about parking. So we think there could be an opportunity, very low risk, to provide some training outside of Grand Forks County, where we could provide perhaps an alternative revenue stream. So I think this is just something that we've been thinking about as we look at some of the changes that COVID has brought forth for us. The other learning that we've tried to focus time on, as some of you know, we have the Safer Tomorrows Roadmap, which is our strategic plan to virtually end violence. A core foundation of that is adverse childhood experiences, which is severe trauma. We know that ACEs, as we call them for short, provide a number of challenges, not only from the emotional side of things, but financially. They're very expensive. These are just a few of the examples of absenteeism costs as it relates to a couple of them. Chronic drinking, depression, and anxiety. We think there could be some potential. We're very much in the exploratory phases of this, but as we take a look at that Safer Tomorrows Roadmap and the long-range plan, we think there could be some potential to partner with a healthcare partner where we could look at how we could quantify our ability to help put a dent in these ACEs and help decrease costs for our community. So these are just some of the things we think of as we look at the fact that we're serving close to 3,000 direct service clients and educating over 15,000 annually. We think that these could be some opportunities where they're already a part of our long-range strategic plan, and how can we move those even more forward further. And with that, I'd be happy to answer any questions you might have.
Thank you very much, Koya, for this interesting presentation. Do any of the commissioners have any questions of Koya? No one has any questions?
Nice presentation.
Yes, very nice presentation, and thank you very much. Again, we certainly enjoy the partnership that we have with you, and we appreciate all that your staff does in our community. And once again, thank you very much for your presentation. It's very valuable information, and we're so glad that your service is available in our area. It'll be exciting when your book is ready for publishing.
Yeah, no pressure. It's half done and half designed, so we got to get it done now.
Okay, well, let us know when it's available. We'll certainly be interested.
Okay, thank you again.
Thank you very much. The next item on our agenda is NDSU extension, talking about commercial pesticide applicator renewal training. Caitlin, are you with us?
I'm here. Thank you.
Wonderful.
Okay, good evening, Madam Chair and members of the commission. I am just on here again. I spoke with you last spring about getting commercial certification testers into our office, and now we are back in the season of renewal again. And so we are encouraging both commercial and pesticide renewal to happen virtually, but the state pesticide office has asked us to consider allowing individuals to come in face to face if they feel that they are not able to participate in a virtual manner. So I've provided a few dates that Fargo has asked us to reserve some space in our building for these different certifications. And so this would start in January with the home, industrial, and institutional, and these trainings take place from 9 to 4:30, so it's an all-day event. And so what we're hoping to help the state with is to offer a place for these individuals to go if they choose not to do this online. So the training does require pre-registration, and we've set up some kind of precautions in place to comply with some of the COVID restrictions, and as well as what public health and emergency management had suggested. So that would be 25% room capacity. Applicators would need to wear a mask the entire time, and we would have 2 staff working so that we can keep one in the office or in the meeting room and one bringing people through the building. And so I did put in there that we could offer bottled water and prepackaged snacks, but certainly that can be removed if that's something that people are not comfortable with. And then we'll disinfect high touch areas. And also we do have a rule on the extension side to sanitize bathrooms every 2 hours. So we can help with that as well. And I can add that to this. I did not get it into the note that I left you guys. And so that's what I have. And so the meeting room that we have in our office at that 25% capacity, or 6 feet apart, would only hold 4 individuals. And it is, it's a small room. So that would be our capacity. And then the other piece that we were discussing is if we could open up that large meeting room up on the 6th floor and just allow for more space between individuals. I wouldn't expect that there's a lot of people that are interested in doing this, but again, I do not know what the turnout would be. So that's why I'm here with you today. And so I just wanted to bring that up to you and in your
Yeah, you certainly have looked at the trainings and made sure that pre-registration is required, so you'll know how many people will be attending. You're looking at a limit of the room capacity. Certainly if the room that you're using in your facility doesn't work, I see no problem in using the 6th floor meeting room if you need to spread out, if you know that more are interested in attending what particular training that you're offering. Mask wearing is required. I don't see that there's a problem as once they're seated, if there's a snack available to them, and you'll be cleaning and disinfecting. The only other thing is just making sure that there's some sanitation available for them, throughout the room. And I don't think that should be a problem at all. And I don't think we need a motion for that. You're just informing us. So go ahead with that information and best of luck. I'm sure there will be some that will opt to do the training virtually, but there may be some that would prefer to come and do it face-to-face as well.
Yes.
So that should be fine. Thank you very much for informing us and putting together the plans in protocols. So best of luck. Thank you very much, Caitlin.
Thank you. Have a good night.
You too. Then the next item on our agenda is Richard Ray, Grand Forks County Historical Society.
I am here. Thank you, Madam Chairwoman. The letter that is on the screen that I sent out, it pretty much explains my position. We realize that we're not a lot different than other businesses and bars and restaurants which have had unusual expenses and loss of revenue, et cetera. But the Myra Museum is the largest of the 5 museums, county museums, and we are facing some abnormal expenses with our post office and general store. So one of the things that the Myra board is looking at is to increase our revenue sources, and there's precedent for utilizing Century Code 111153. It's been many years, I think, since the county has used that, but they have used it in the past. And so I guess what we're asking are really 2 things. One is whether the county is willing to support the museum, this museum and the other county museums, for the $5,000 for this year, and what the position would be on using that law in the future. Now, we do understand that the county has a budget and you can't just automatically drop things and start issuing money. We understand that. But we think the Myra Museum is an asset to the community, and we hope that you can support it. And so I'm open to any questions that you might have.
Okay, do we have any questions of commissioners to Mr. Ray?
Madam Chair, this is Commissioner Ross. I've been out to the museum several times, and I think it's a very valuable asset to this community. A lot of historical value. I would ask the auditor, do we have $5,000, Madam Auditor?
Madam Chair, Commissioner Ross, members of the commission, yes, we would use it from cash carry forward, $5,000. The law does allow us to do that. The last time we did it was in 2005. A motion was made to do it, was at the end of the year, and we did in 2005, and another motion was made at the same meeting to do it in 2006 as well.
Then I would, at this point, make a motion to approve the request of the Historical Society to give them $5,000 out of cash carryover.
Okay, is there a second to that motion?
I'll second that motion.
Okay, we have a motion and the second. Discussion. Would anybody choose to have discussion? I would, one of the things, Mr. Ray, is in doing this probably for this year, which the budget is usually done in July and approved sometime in August or September. My suggestion in the future would be to contact our auditor's office about possibly getting placed with budgetary discussions, so it can be something that can be looked at on an annual basis, but an annual basis when budgets come in and those budget discussions are held. That would probably be the best way to do that. Since there are no discussion for this motion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. So $5,000 is for the year 2021, 2020. Okay, $5,000 is approved for 2020. Probably in the future, though, I would suggest that you do it when the budget comes forward to the commission sometime in June or July.
Thank you, Madam Chairwoman. Appreciate it very much.
Thank you very much, and thank you for all that you do to improve the historical value of Grand Forks County. We certainly appreciate it. Okay, then item number 13, County Planner, Mr. Magnuson.
Madam Chair, members of the commission, I have one item tonight, and it is to consider the application of HOTLINE International for a special use permit for a temporary cold weather drone testing site in the east half of section 29 of Washington Township. The subject property is an almost 300-acre parcel of land. All schools in one of the property. The site is located at the intersection of State Highway 18 and 2nd Avenue Northeast. City of Athens is located 4 miles to the site, south of the site for reference. Otherwise, surrounding land uses are farmsteads and agricultural lands. According to our land use plans located within our agricultural area, the special use permit does conform to the goals and policies of the land use plan. Under our zoning ordinance, it's within our A1 agricultural zoning district. And this proposed use fits best within the definition of a private airport, so it is listed as a special use in the zoning district. As far as the background, the applicant is proposing to construct a temporary tent and a couple other small temporary structures for generators and other ancillary equipment for the cold weather drone testing site. In your staff report, it does reference they did want to put up 6 50-foot towers. That is standard for their drone testing sites. However, they're for, my understanding is they're for lightning deflection. Since it's cold weather, they don't really require that. And they didn't want to, then they don't have to hassle with financial guarantees either. So the site plan has been amended since the planning commission meeting. So if the staff report's different that I'm reading than what you're getting, that's the reason why. Other than that, they said that like I said, the drone testing will only take place during winter months, and all activities will be completed by the end of the 2021-2022 winter season. After that time, all structures and equipment will be removed from the property. The site would access the existing approach to State Highway 18, which is shown on the site plan, and the applicant has also submitted the attached letter, better explaining in more detail the proposed use and kind of what they do. As far as a township recommendation, I did talk to Washington Township Board Chairman yesterday. They had no comments and recommended approval of the request. As far as staff comments, as you can see, I did have several questions for them, and in the staff report were my questions and corresponding responses regarding the size of the aircraft. You can see from the picture, they're a little bit over 9 feet long. There's a picture of people holding it for reference to size. As far as the hours of operation, it would be 8 a.m. through 6 p.m. Monday through Friday. As far as any type of noise disturbance, they did submit a graph showing that standing right next to the drones when they're launched, they would have approximately the same sound as a vacuum cleaner. Once they're at 300 feet where they're going to do their testing, they're basically inaudible, so it wouldn't be an issue. As far as their the months they be testing, typically it would be November until mid-April. But again, like I said, we're focusing on cold weather, so if it's warmer earlier or later, then they won't be doing it. As far as the maximum number of flights per day, it would be between 8 and 20. However, there would be rare occasions where they would have higher flight volumes. And they did indicate that they would be removing everything and be done with collecting their data by April, actually 2022. So with that, the Grand Forks County Planning Commission recommended approval for the request at their December 10th meeting, and planning staff would also recommend approval of the special use permit with the one condition that the site should be all. Let me get this right, so make sure I get those minutes right. Sorry about that. All equipment and structure shall be removed from the site no later than June 1st, 2022. With that, I'd be happy to answer any questions. I know Mr. Howard Swanson, the applicant's legal counsel, is also on to answer any questions. So,
Okay, do any of the commissioners have any questions of Mr. Magnuson or Mr. Swanson at this time?
I just have a question.
Madam Chair, this is Howard Swanson. May I make just a couple of introductory comments, please?
Sure, sure.
Again, thank you, Madam Chair, and commissioners for considering this request. It's my privilege to represent Zipline International. Just to give you a little bit of background, they truly are an international company. Currently, they have significant activities in Africa in which they are doing medical supply delivery by drone. North Dakota has a little different climate, however, than Africa does. Somebody told Zipline that it gets cold in North Dakota in the wintertime, and perhaps even have some wind and snow. What they are interested in doing is doing equipment testing of their small UAS vehicles here in North Dakota. They are currently doing warm weather testing in California and another site in Southeast United States, but this would be the only cold weather testing. They wanted to start in December of this year. They will have 2 winters of testing. They'll have the 2021 season and the 21-22 season. There will be no permanent installations. The flights will be conducted in compliance with FAA requirements, and it is also being coordinated with local officials with UAS background, including the University of North Dakota. The property is arranged, the lease has been arranged with Paul Spruill. I think he's fairly excited about it. We would ask the commission to give final approval of a special use permit. There are 2 reasons. Number 1, it is consistent with your planning and zoning code requirements. And number 2, perhaps as important, it furthers the county's commitment to the continued growth of the UAS industry in Grand Forks County. And as Mr. Magnuson told you, originally they had looked at using lightning towers, which they have done in the other test locations. After further analysis, the determination is made that the lightning towers just aren't needed here in the wintertime. If for some reason it's changed that they'd be needed in the future, we'd come back to the county and provide the necessary financial assurance. But right now, we are asking the approval so that they can move forward as quickly as possible and take advantage of our winter weather.
Okay, thank you, Mr. Swanson, for your comments. Ms. Knopf, I believe you had a question.
And it's just a question out of curiosity. And it says here the planning department shall receive a township recommendation prior to the county commission meeting. And so no recommendation or not receiving the recommendation, it's that, I mean, it's okay.
Yeah, Commissioner Knopf, I did not receive a paper recommendation, but I did talk to the township chairman over the phone yesterday, and he said there's no issue.
Great.
Okay, does anybody have any other questions?
Madam Chair, this is Commissioner Ross. I would move for approval of the special use permit request of Zipline International.
Okay, all right, is there a second? And it has been seconded by Commissioner Knopf. All right, any discussion? If there is no further discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Thank you, Mr. Magnuson, and also thank you, Mr. Swanson, for your comments. I hope they're very successful in being able to get medical supplies and products delivered in certain countries. That's wonderful.
Thank
Okay,
you
the
again,
next,
Commission.
thank you. The next item on our agenda is County Engineer, Mr. West. I believe you have a couple of items to go through with us.
I do, Madam Chair, members of the board. Can you hear me okay?
Yes.
Okay.
No? Could you speak a little louder?
Is that better?
Yes.
Okay, I'll move my microphone a little closer.
Thank you.
It's been a while since I've been in front of the board. I'm not sure if that's good or bad, maybe a little of both, but 2 items for consideration. The first is I think it's great news. We received our financial compensation for that bridge that was collapsed last year. And I'd like to apply it to a bridge that's nearby. And my logic behind that is, one, my opinion is, or the highway department's opinion is that the bridge that was collapsed is a very low priority road, and I don't think it's the best use of our funds, frankly. And there is a bridge about a half mile away that is used, and it's mail route, bus route. We plow the snow. It's regularly gravel and traveled and used for daily commuter and a lot of ag traffic on it. And that bridge is in poor shape, and it'd be a great bridge to replace. And I think the money should be used on a bridge. I think it should be used in a bridge in Northwood Township. So the same folks that would have used the bridge that collapsed can take advantage of that funds into the future. And I guess with that, that's my request, is to replace that bridge half a mile away.
Okay, so there's been, Mr. West is recognizing that the funding we received from the Northwood Bridge that went down, he would like to put it towards a bridge also located in Northwood Township, about a half mile away. Any comments from commissioners?
Commissioner Falk.
Go ahead, Tom.
Commissioner Falk here, and I agree totally with Mr. West. I think we've talked about this before, and I would move approval of his request to spend the funds on, I think it's Bridge 115-34.0 Northwood Township.
Okay, there is a motion forward. Is there a second to that motion?
Madam Chair, this is Dave. I'll second it. And even though I live in Northwood, I don't think it's a conflict to approve of this, because the people in this community are really happy about the idea of having that other bridge fixed. And I think Nick is right on point. I've seen the underside of that bridge, and good thing to fix that one. But we've got lots of others in the county too. So if someone disagrees, speak up.
Okay, so we have a motion and a second. Any other comments that commissioners would like to make? If not, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Okay, next item, Mr. West.
Yeah, the next item would be on the same topic, then would be permission to extend the contract with the consultant that performed the preliminary engineering on, well, actually on both the bridges. We've already conducted the field survey and some preliminary design on both bridges, but since they've already done a lot of the base work, is to allow them to continue the project and complete plans and specs, and then get permission to advertise for bids. I would like to also say the project, in my write-up here, I said probably completed in 21, maybe 22. And after visiting with the folks over at KLJ, 21 is possible, but things would really have to fall in line, particularly from the environmental standpoint, and get an Army Corps permit. From a design standpoint, it wouldn't be that tough as far as what the engineers need to do, but to get the permits in line, environmental clearance, they're thinking 2022 would be better. It would allow for the biologists and cultural folks to get out there and do what they need to do, and wouldn't have a compressed time frame, and it wouldn't force our hand on a late season construction, because if we did it in 21, we're forced to, an August, September timeframe right in the middle of harvest, and that's not ideal. Versus if we do a 22 project, we can bid it out in the winter. They can start, spring and summer, and probably have it completed before harvest, and that would be our goal anyway. So just to be clear, by statement in here, I'd recommend we move it to a 2022 project. So.
So you're looking for the commission to approve going with a particular vendor to do the prep work, and then get ready to open it up for bid, and the construction to be done in 2022?
Correct.
Okay, does anyone want to make that motion?
I'll make that motion.
Okay, the motion, Ms. Knock has made a motion. Commissioner Engen, would you second that motion?
Sure.
Okay, any discussion? If there's no discussion, then assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried.
Thank you.
Then, Mr. West, did you also want to speak to America's Township FEMA reimbursement?
I would, yes. Thank you. So we have a unique situation in our FEMA funding coming through for this particular township where they had a project that was so large and they combined the whole township into one project, and it's such a large dollar amount that the rules for reimbursement are different. That's over that 131,000. So the bottom line is the FEMA and the state will not give the township, well, the county, but the county gives the money to the township, but essentially won't give the township the money to finish paying the contractor, Gowan Construction, for all the work until Gowan Construction releases proof of payment. Well, Gowan Construction can't release proof of payment until they've been paid. That makes sense. But the township can't pay the contractor because they don't have that much money. It's just way too much money for them, and they never will have that much money. And I don't know how else to finish this and get the project done and the funds coming without some kind of a loan system. And I thought it was maybe prudent to ask that the county temporarily loan America's Township $34,000 for, I'll say, half of it probably reimbursed in the next few months, and the other half will be reimbursed by the end of the year. I do have commitments from Department of Emergency Services that this money is coming. I verbally talked with them about the situation. They're aware of it. They say it's a common thing that happens in other counties. I guess we just haven't had that in our county in all the FEMA declarations we've had in the recent years. But the other option is for the township to go to a bank and get a note. Those are the only two scenarios I see this working out. So I'd like to just bounce that off the board and see what they think. I did visit with Debbie Nelson about this, and her opinion is that it was possible, but we'd want to wait till January so you're not borrowing money from one year and paying it back in another year and affecting year-end balance. That's fine. It's not a big deal because America's Township wouldn't be able to pay their 15% of remaining funds to Gowan Construction anyway until they get their property tax money for 2021. So regardless, Gowan Construction would get paid till probably February next year anyway. The money could either come out of the highway department fund somehow, or one of our two funds, or the general fund. And the highway department's fine. I mean, we can float 34,000 for a few months.
Okay, so Ms. Nelson, we can do a loan to America's Township for the $34,001.64, and that could come out of the highway department fund, but potentially have it come out in 2021, correct?
Correct.
Okay, discussion by commission. Any comments?
Madam Chair, I would make a motion to approve that request.
Okay, so the request would be to do a temporary loan to America's Township for $34,001.64 coming out of the 2021 budget, and we would be reimbursed that funding back from America's Township in 2021, correct? Okay.
The highway department budget?
The highway department budget? Yes.
Yeah.
And is there a second to that motion? Okay, then Ms. Naffa seconded it. Is there any discussion? If
Madam
not,
Chair, this is Dave.
what did you,
Go ahead.
Commissioner?
Yeah, just Debbie and Haley, we're okay legally? Any issues? Have we done it before?
Madam Chair, Commissioner Ingen, members of the board. No, we haven't done that before. I know the general fund, we could definitely do it out of the general fund. Can we make a loan out of the highway department? I'm not as certain on that. Do you have
Ms.
any
Wong?
comments, Haley?
Members of the commission, Ms. Nelson, I would agree with what Ms. Nelson just outlined. I'm not certain if it could come out of the highway department's fund, but maybe Ms. Nelson and I could visit about it and look into it a little bit further.
So the first priority would be the highway fund, but if that's not a possibility, then we could do it out of the general fund.
Yes.
Okay. Then we have a motion and a second, assuming a roll call vote. All those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Okay, anything else, Mr. West?
Yeah, just one other comment for the board. So we have, we got the grant, well, it'd be a little over a year ago now, to do 2 bridges in Grace Township. They're being designed. They're going to be bid out soon. They'll be constructed this summer of 21. One other step that I will need some help with is the construction engineering portion is eligible for federal aid, but in order to use federal aid, we have to go through a selection process, and that is tied with Walsh County as well too. So the 2 counties will need to go through a selection process. We solicit for proposals. We have to do interviews. We have to go through that process. So I will be coming back to the board probably in January with a request for a selection committee. So probably a commissioner or 2 or a commission representative of some sort will be requested to sit on that selection committee, or a designee of that. So just a heads up, that will be coming. And it's a good thing because they'll pay 80% of the construction engineering. So that's nice. But
And I'm assuming then Walsh County will also be participating in that process?
Correct.
Okay. Well, thank you very much for that heads up, and we will be more than happy to deal with that in January.
Sounds good. That is all I have for now.
Okay, thank you very much, Mr. West. I appreciate it. Okay, the next item on the agenda is the county reopen date.
You want me to take that?
Yes, Mr. Ford.
Madam Chair, I will do that. Hopefully I won't blast out Michelle over there. Yes, Madam Chair, I've been asked to clarify a few things pertaining to the county reopening date. Currently, we are in phase 1. What does that mean? Essentially, the building is closed to the public. It's been closed to the public since March. Non-essential personnel are to be working remotely. Things have been going well. Yes, we've had hiccups, but we've been able to iron those hiccups out. Department heads and essential staff have had access to the building since the commission closed the building in response to the pandemic. And department heads can bring, I think I already said this, I apologize, but bring those essential staffs they deem essential to the office to do work that needs to get done more efficiently. Departments wanting to bring members of the public, clientele, constituents, etc., into the building up to this point have needed to seek approval from the commission to do so, and they've had to present a plan on how they would efficiently bring constituents into the building. And there are some departments that have done this, and the board has reviewed this, the restart team has reviewed it, and the board has approved that. So things have been going well. The January 4th date was approved upon by the board back in September. And if things proceed the way they are planned, we would be moving into phase 2 of county reopening. And what does that mean? The highlights are that department heads may bring back more staff to the office area, but those department heads have still been encouraged by the commission to have as many employees as possible work remotely if things continue to work for those departments and those employees. And this is the key difference here. is allow members of the public into the building by appointment only. So the proposed phase 2 in the restart guide that was approved by the commission in September is not a full-on opening to allow people to come and go as they please. It's by appointment only. I've done some checking with some of our peer counties, most specifically Cass County, and this is the model they've been using, by appointment only. It's been working for them. Departments in the courthouse and the COB submitted the safety plans like the commission asked them to do. They have plans for bringing staff back. They have plans for meeting with constituents by appointment, meeting them, escorting them, screening them, etc. One other important thing I must stress is that departments are responsible for screening their clients, their constituents. Northeast Human Services, which since March had a table in the lobby to screen their clients, they won't, nor should we ask them to screen other county department clients and constituents. I believe in talking with Mr. Slevins that when the county does proceed to phase 2, they'll move their screeners up to the 4th floor. So the doors would remain locked in phase 2, but departments don't need special approval from the board to bring clients and constituents into the building. There are still 2 questions out there. Once we proceed into phase 2, that is, what would the board want to do with large meetings, such as 10, 15, 20, 25 folks up here in the conference room? And what about the courthouse? So the commission did close the courthouse in March as well. The commission did give the court administration approval to start allowing constituents into the courthouse for things like jury trials, bench warrants, things like that. But to date, constituents have not been granted access into the courthouse to do their transactional business with the clerk of court's office. I did reach out to Judge Hager, the presiding judge, and included Scott Johnson and Rebecca Absey on the email as well, just kind of think what are their thoughts with the commission moving forward. Haven't heard back yet, but it would be my advice or my recommendation to the commission that really the discretion be given to Judge Hager as to what he would like to see done in opening up that building a little bit more to allow transactional business to happen at the clerk of court's office. They are separated from constituents. It's a little bit more controlled access, as Commissioner Ross knows as well. And I think it would also ease some burden that's been brought on the sheriff's department and the police department. So that's just something to consider for the board. So that's kind of my quick, in a nutshell, recap. And so the decision before the board, as was brought back in the first December meeting, was are the wishes of the board to continue, and with January 4th being the phase 2, entering into phase 2. There was some discussion about maybe the board wanting to push it back to January 15th to see what happens with the Thanksgiving after effects, Christmas after effects, New Year's after effects. And what I mean by that is cases, what's going to happen. We have been trending in the right direction with cases. However, you'll note that you are seeing less people going in for testing. So there is a correlation there. And this is, I'm venturing into Kari's and Debbie Swanson's arena, I know that, but the percent positivity is something else to keep an eye on, and that seems to be going in the right direction too. So that's the decision before the board today, is do you wish to proceed with entering into phase 2 on January 4th?
Okay, discussion by the board. Would anyone like to make comments?
Madam Chair, this is Commissioner Ross.
Yes.
I would like to see the county proceed with the January 4th opening into phase 2. I would also like to see, as far as the courthouse goes, leave it up to the discretion of Judge Hager as far as what they want to do over there. But I know there is a lot of things going on with the police department and the sheriff's office having to collect fines and fees and things like that that should be done in the courthouse. It should not be done over there. So I guess I would like to put that in the form of a motion.
Okay, there is a motion before us. Would anyone care to second that motion?
I'll second it for the sake of discussion.
Okay, that motion has been seconded. Discussion.
So my concern, it isn't that I disagree, but when you think about it, we've got Christmas. We don't know what's going to happen with that. We know
Could you speak a little louder, please?
Yes, please.
Please speak louder.
We know that there will be people gathering for Christmas. I mean, Thanksgiving, they probably didn't do as much, but I'm thinking at Christmas, we're going to see a lot of people gathering with family, friends for Christmas, for the holiday. Also, you have New Year's Eve. Well, we know what happens typically on New Year's Eve. It's you gather with family and friends, and sometimes that's in large groups. And so my concern is that by January 4th, we probably aren't going to have seen the effects of that or what might have happened. I don't even know if we would by January 15th, because generally I think they say 2 weeks to a month's period of time before, you might see people that have been exposed where the numbers would go up, assuming that those people were tested. If they're not tested, we don't know. So I guess that's the only comment I just want to make on that. I think it's time to consider seriously opening to phase 2, with more staff coming on board and with very limited community members in the building. I don't think we're ready for large meetings yet. I would be opposed to that. And then my only other concern with all of that is then what does it look like for phase 2 with clients, the public coming to the office? They make an appointment, and so then does that mean then that our staff or designated staff, county staff, would go down, meet them, bring them up, and return them? Is that they would be responsible for that and for the screening and all of that?
Yes, Madam Chair, Commissioner Knopf, you are absolutely correct. So we'll use Ms. Beal, we'll pick on her. If she has an interview coming in, she makes that appointment. She would even perhaps want to do some pre-screening questions on the phone call when she sets the appointment. And then, depending on how she wants to do it, she might instruct the candidate to call her, let her know that person's at the door. Ms. Thiel would meet that person at the door, hopefully masked up. That person hopefully would be masked up. And again, public health has provided some screening questions that can be asked. So yes, if it's whether it's Ms. Nelson's staff or Ms. Thiel's staff or whomever, they are responsible for this pre-screening, setting the appointment, meeting at the door, escorting to and from, and making sure they get out of the building safely.
Thank you. And my only concern with all of that and not having somebody sitting there during the screening is that a lot of people have become accustomed to having somebody there that will open the door and let them in. They can drop off papers, they can, call their worker, whatever, from that point, and or at least tell them that we're not able to let you in, and now we're going to where nobody's manning that door and nobody's answering their questions or directing them on what they should do, like you need to call. All they know is they're pulling on the door handle and there's nobody there. And so that concerns me. And some of it is because of the weather, but also because I think we have a responsibility, we've been doing it. I think I'd like to see us continue doing that, but I don't know how you do that without having somebody manning that on a daily basis.
Madam Chair, Commissioner Knopf, the point you raise is something that the restart team went around and around with.
Okay.
And at the end of the day, I polled department heads and I asked them, would you be willing to provide staff, dedicated staff to sit at the door? Our department heads don't have the manpower to designate staff to sit at the door and do that. Then we talked about, well, could we hire somebody to do it? Whether it's a temp agent's contract, well, we discussed contracts with CVIC and that's very difficult for a non-home ruled county to do right now with benefits and things like that. So then we talked about like a temp service, like a Kelly's temp service. Could the county afford to pay an individual for the next, say, 12 months to sit for 8 to 9 to 10 hours a day and do that? It would get very expensive. And the discussion was, well, okay, what about the CARES Act money? Well, doing that would wipe out our CARES Act money probably within 6 months. So that's, again, we probably went around it for a week, Michelle, would you say, maybe more, about how to make it work. And at the end of the day, we couldn't make it work. We just would have to go with the appointment only, and the departments would have to be responsible. Yeah.
I agree.
But no, that was the biggest sticking point for the restart.
Well, and I don't think we have to go with 9 or 10 hours a day. I mean, it would be the normal work hours, and I don't know, but it's just a thought. I think some of the rehashment that our clients needs, because we are answering that door, even though they may be turned away, at least there's a warm body helping them and answering their questions and telling them how or to get entry into the building. And so I'm just concerned that we wouldn't be able to do that or wouldn't be doing that anymore. And then we may be getting some bad feedback.
I would anticipate it.
Oh. I don't know if we want to go there.
Madam Chair, this is Tom.
Yes.
I don't disagree that we should look towards trying some sort of a soft reopen. I think the team has done a lot of work on it. If I recall, at the last meeting, I suggested that when we put it off on the 1st of December, our first meeting, that we no longer were going to be giving our employees 30 days notice that we were moving towards doing this, which I think we should. And that's why I'm going to propose that what we should do is we should look at opening on the 18th of January, which would give them 30 days notice. And it'd also give us some time to get any of these bugs that we've got in our system straightened out. The other thing, I think that might address Commissioner Knopf's concern about increase in COVID here after the holidays, which nationally everybody is talking that it's going to happen. So I think we can probably expect it's going to happen in our community also. But, if that did occur and there were problems starting all over again, we could pull a chute on this and delay it at that point. So I think it would be better to look at the 18th of January.
Right now, Commissioner Falk, we have a motion on the floor that's been passed, or that's been a motion that has been made and seconded, that we go with the restart on January 4th, I believe. So we have to vote on that first. So let's do. Just any other discussion?
Yeah, I have one other, and I'm fine with that. I'm going to vote against it because that's my thought on that. But the other point I wanted to make is, as far as at the courthouse, I think we have to do something there. And I've asked Mr. Ford to look into that, to set up some sort of a drop box. I talked to the sheriff again today about it, and it's just becoming it's becoming a problem for them. And if they put a drop box in the foyer of that building for payments or whatever, that would certainly solve some of it. And so hopefully
in the courthouse or in the police?
In the foyer of the court. And when you enter that first set of doors, there's still a second set, but You know, the talk was to put one outside, and apparently the court didn't like that. But, you know, as the sheriff pointed out, we voted very well with a box sitting outside in the parking lot. So I think that might work over there. Anyway, those are my comments. Thank you for listening.
Okay, any other comments? All right, then we have a motion that was made by Commissioner Ross and seconded by Commissioner Knock, stating that we should go with the county restart phase 2, starting on January 4th of 2021. All of those, assuming a roll call vote, all of those in favor of that motion signify by saying aye.
Aye.
Okay, all of those opposed, same sign.
Aye.
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 Okay, then the motion does not, the motion dies. It has not been carried. Would anyone else prefer to make a different motion?
Madam Chair, I'll make a motion.
Okay.
Commissioner Falk wants to do that. But I would make a motion that we look at a restart or an opening effective January 18th. And that would be a phase 2 reopening, which would mean then bringing more county employees back into the building and meeting with our clients by appointment only. And also included in that would be no large meetings until further notice.
Anything with the courthouse? Anything is the motion with the courthouse at this time?
No, not for me.
Okay.
I wasn't listening. I'm sorry. Courthouse.
Madam Chair, yeah, I know that there was some discussion during the first motion for discussion about.
To let Judge Hager.
Yes, ma'am.
Yeah. Okay, so I'll include that as part of my motion.
To let Judge Hager make that decision for the courthouse? Okay, we have a motion. Would anyone care to second that motion?
I'll second it, Tom.
Okay, any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign.
Aye.
Okay, so this time it's 3-1 and that motion is passed. So we will look at a phase 2 restart taking place on January 18th of 2021. And then Judge Hager will be informed for him to make a decision based on the courthouse building.
And Madam Chair, one follow-up item to that. Ever since the commission closed the Cobb and the courthouse, the Cobb more specifically, we have not been charging for parking permits.
Okay.
Just because of, well, 2 reasons: the parking ramp renovations, and because most of the employees haven't been in the building. I think it's prudent because we have lost significant revenue that goes towards maintenance of that ramp, that we begin. I'll basically be sending out a note to the employees that we're going to once again resume. But back to the spirit of Commissioner Falk's giving them notice, I think we give them a 30-day notice. So it's not starting on the 18th. Maybe we start on the 1st of the month.
February
1st. Yeah. That sounds fair.
Okay.
Okay, wonderful. Thank you very much for that information. All right, the next item on the agenda is the finance and tax. Debbie.
Madam Chairman of the Commission, I need a motion to authorize a commissioner to approve any bills that come in before the end of the year.
I'll make that motion.
And who are you going to appoint?
Well, I would say Commissioner Peach, but if she is out of town or I'm in town, so whatever, but I would say Commissioner Peach.
Yeah, that's fine. And that motion has been made to authorize myself to approve any bills that come in before the end of the year. Is there a second to that motion?
Second.
It has been seconded by Commissioner Ross. Any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. And also you have budget amendments, Debbie, for 2020.
Madam Chair, members of the commission, I need a motion to approve the budget amendments for 2020. All the funds that are listed there all had offsetting revenue. So we've collected money, we dispersed money, and I need a motion to approve those budget amendments. And my computer quit, so I'll be there in a minute here. Okay, there's the motion. So every one of these expenses have offsetting revenue. So I need a motion to approve these budget amendments.
And that can be in one motion, correct?
That's right.
Okay.
Motion to approve, Tom.
Okay, there is a motion to approve. Is there a second to that motion?
Second, Dave.
Okay, it has been moved and seconded. Any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Anything else, Debbie?
No, thank you.
Okay, thank you. The next item on our agenda is Director of Administration. That's Rich. Oh, sorry, Rich Axfig. I apologize. Thank you. Mr. Axfig, are you on the line?
Yes, I am, Commissioner Chair Peach. I'm here on a smaller item, and as you always can relate to me, it's about water. Guess what? It's about water. I have a question. There is a group by Oslo that is working to try to figure out how they can solve the problem at Oslo called BTAG. My question is, has the BTAG been given the commission a video presentation in the last 6 months?
No.
I don't think so. No. I don't think we've received any presentation from that group.
Okay, so my purpose today is a little bit of heads up that presentation will probably be coming shortly after the first of the year. My other question was to Tom Ford. I said, Tom, have you been on base or up to speed on BTAG, or was that start before you did?
No, Rich, I am not up to par on that.
Well, just
Chairman Peach.
Yes.
This is Kari. Madam Chair, I have been involved with BTAG. I have seen the video presentation. I wasn't going to bring it forward until after the first of the year because I needed time to discuss it with Tom Ford and also with Rich and the Water Board. So it's not a secret, Rich. It's out there. I am not, I'm not a water person. So I think what they're trying to do is admirable, but I'm not sure engineering wise whether or not it's going to be effective, and it comes with a large price tag. So that's my 2 cents, Rich.
Yep, that is very helpful. And my purpose was really just to update the commissioners on what their next step is, and that is to try to form a joint powers agreement. And they want us, Grand Forks, to be part of that joint powers. Right now, BTAG stands for Border Township Associative Group, and it pertains mainly of landowners from 7 townships, 3 on the North Dakota side, 4 on the Minnesota side, plus the city of Oslo. And their main purpose is to try to come up with some solution to the flooding that occurs at Oslo over the last couple of years. Been quite often, like last summer, last fall. I mean, they they need to do something. And so their effort with us 2 weeks ago was a short video. And the request for a joint powers person member from Grand Forks County, I didn't take that lightly. And so that was mainly the reason I texted Chairman or Commissioner Knopf last night, and I said, "What do you think about that?" And she said, "Well, I'll put you on the. I'll try to get you on the agenda, and you can talk about it." So I'm glad that Carrie, that you popped up, and I would be more than willing to work with you and Tom on discussing this BTAG thing further after the new year.
And Rick, Rich, I think we need to involve Nick West because he's very familiar with the engineering aspects of all this. And I think for the commission, once we put the pieces together, we will come back and we will discuss this with you.
Yep. Oh yeah, definitely, Nick. Well, you know, this is not new. It goes back to about 2004 or 5. Nick has been involved, and myself and our engineer Jerry Privula has been involved. So we've been there, we've listened, and now they have asked for this joint powers to be formed. And so I just wanted to make sure that the commissioners are up to speed on what the next process or next step they're trying to complete. They have hired legal counsel, and so it is basically they have a bridge that they feel is not big enough, and that's the main part of this overall plan. So with that, I will see you in another year, Carrie and Nick. We'll talk a little bit about BTAG, but I would
and Mr. Ford, I believe.
And Mr. Ford, but I would guess you're going to be contacted and asked to listen to and visit about this video that is pretty up to date. So thank you for sticking me on the agenda, and it's getting to be dark, so it's time to quit.
Thanks, Rich. Yes, thank you very much for that information, and thank you to those who will be working on this project in the future. The next item on our agenda is Director of Administration, Mr. Ford.
Yes, Madam Chair, members of the commission, I owe you an update on the county COVID remodel. We got to find a better name for that. People think we're actually remodeling the top. So after the board gave myself and Ms. Wamstead some instructions to reach back out to ICON to publicly bid, I did follow up with ICON, and I put them in touch with Mr. Grishevsky concerning the HVAC. So a couple of updates. ICON has met with Bill and with Johnson Controls because they do the monitoring of our system. They also went over to the courthouse to take a look at the state's attorney's space, which is also going to see some remodeling for COVID risk mitigation. And it was determined that there's going to need to also be some electrical system changes because you're basically changing an HVAC system. And so they need to be made in the courthouse and down on first floor south. So Ms. Nelson's area there. An engineering consultant was brought on by ICON, Auburnell Engineering. And because we are so far behind in this project already, ICON asked if I would be fine with $7,800 to have the engineering consultant put the plan together and what we need to do. I said, yes, let's go ahead. We've got to get this done. So that's being done. ICON estimates RFPs Ms. Wamstead and I will have RFPs to review and be published by the second week of January. That puts us probably at, I'm going to say first part of February to open bids. So ICON bring a bid to myself and Ms. Wamstead for recommendation, bring it to the board. That's probably going to be unless we do a special meeting, we're probably looking then at the 3rd February meeting for the board to approve, with work probably starting then the end of February. So that's where it's at. Unfortunately, we're incurring more costs. We also know we're going to incur a few more costs for architects and engineering fees because we have ICON being the project manager. And it's definitely was a good part on the board to publicly bid because we're now inching even closer to that threshold. So that's where we're at. Happy to answer any questions.
Mr. Ford, Commissioner Ross.
Yes, sir.
Does the historical people have to get involved in this when we change the inside of the courthouse?
Yes, Madam Chair, Commissioner Ross, good question. We did, myself and Ms. Wamstead did meet with the Historical Preservation Society, and they gave us their blessing. Good. Mm-hmm.
Madam Chair, Tom here. My question is, as delayed as this project is getting, and I don't see us starting construction the end of February at all, but is COVID going to be taken care of by vaccinations and herd immunity before we even get our project built?
I would doubt that. What I've heard on the Board of Health is that we're looking at, with the way the immunizations are coming at a much slower pace than anticipated, we're looking at June, July, August, maybe for us to have even enough vaccines available for our public. And that could be delayed at this point too. So, and one of the things that was talked about was, as we move forward, let's hope we don't have another pandemic of this volume, but let's hope that the things that we have put into place and we have done will help to prevent some issues in the future. So that's kind of how the Board of Health is looking at it. We're even hoping that by 3rd quarter, there'll be enough vaccines available. It's so early, as Dr. Waltz has said, it's so early in this pandemic, and they're coming out with this vaccine quickly. They've had to go through the phases of testing that it has been required by the federal government and by the FDA. We still don't know when we'll fully say that the country and the world has been fully immunized. So that's kind of the discussion that's happened with the Board of Health.
Madam Chair, Commissioner Falk, in the institutional partners meetings I attend every Wednesday, all true representation participates. And we're being told in those meetings, we're still in this for another 12 to 24 months. And not only that, but this project also addresses a lot of just safety concerns.
Security.
Thank you. Thank you, Commissioner Ross. And these are concerns that many department heads have been bringing to me since I've been here for 8 years. And the problem is it's always been difficult to find adequate funding to put these measures in place. And with the money we've gotten for CARES, we can take advantage of that finally. And this is a proper use for those funding. So it's I would say we're still in the COVID for quite a while, but this also takes care of a lot of concerns our employees have been bringing to us.
You could call your project security redesign.
All right, I'm running with that.
Update or update.
I'm running with that, Commissioner Ross. Thank you.
Okay, any other comments? Anything else, Mr. Ford?
No, ma'am, that's all I have.
Okay, then we will move to Ms. Wamstead, State's Attorney.
Madam Chair, members of the Commission, I do have a number of items to address with the Commission this evening, and I will try to move as quickly through them as possible. The first item included in your packet was an agreement with Safe Kids, a Department of Altru Health System. If you recall it about a month ago, the commission passed a motion to enter into a service agreement with this organization in the amount of $25,000 for the 2021 calendar year. So this agreement memorializes that motion passed by the commission. So I would just ask for a motion for the chair's signature on this agreement.
Okay.
Madam Chair, I'll make a motion for chair signature on the agreement with Safe Kids.
Second.
Okay, it has been moved and seconded. Any discussion? If not, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, opposed, same sign. Motion is carried.
Thank you. The next item I have is another agreement for services. This is for the defense services for mental health civil commitment cases handled by our office. This expense is an obligation of the county. This agreement is consistent with that entered into last year, and I believe even prior years as well. The monetary amount has not changed in any way. The only change is that it's specific to the year 2021. So likewise, I'd ask for a motion for the chair's signature on this agreement as well.
Okay. Would someone like to make that motion?
Madam Chair, Commissioner Ross, I make a motion that we approve the mental health defense service agreement.
Okay, is there a second to that motion?
I'll second.
Any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried.
Thank you. The next item I have is a fireworks application for the commission's review and approval. To give you a little bit of a background on this, chapter 2315 of the North Dakota Century Code, which was included in your packet, provides that the county commission is to approve any applications for public display of fireworks. I don't know that this has really come to our attention in the past because it isn't frequently dealt with out in the county. The city does have a similar process. And so when this did come to our attention, Mr. Ford, Ms. Nelson, Sheriff Schneider, and I visited about this process and reached out to other jurisdictions. Ms. Nelson put together the application that is quite consistent with what we saw from a lot of the other jurisdictions. She can maybe clarify if I misstate anything, but I believe the process will be where if somebody wishes to have a public display of fireworks, they would submit this application to Ms. Nelson's office. She would then forward it to Sheriff Schneider's department for kind of a safety review and any recommendations that they have. And then it would come before the commission for final approval. So we just wanted to bring this to the commission's attention, solicit your input or any changes you might have on this process or the form. And if it's acceptable to you, we likewise would ask for a motion to approve.
Okay. Would anybody, any comments from the commissioners?
Madam Chair, I move approval.
Okay, Commissioner Engen has made a motion to move approval of this application. Is there a second?
I'll second it, Tom.
Okay, it has been moved and seconded. Any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Okay, and everyone has approved, and so there's no opposed. The motion moves for is approved.
Thank you.
Okay, anything else, Ms. Wamstead?
Yes, I do have a couple more items.
Okay.
One additional item is as part of my role, I sit in as legal counsel on the weed board meetings. Since the weed board members were not able to be present today, they asked if I would relay a message for them. They passed a motion unanimously requesting a pay increase for their 2 employees, consistent with the percentages from the other or 4 other county employees. They don't automatically get that step because they're not full-time employees. And so I indicated I would relay that request to the commission on their behalf.
Okay, so there is a request coming from the Reed Board to increase their 2 part-time employees. Are we aware of what that level would be?
3%.
3%
is what they're looking
for.
for.
Okay.
And just so the commission's aware, I also did bring this to the attention of Ms. Thiel. So she is aware of the employees and what their motion is as well.
Okay. Any comments you'd like to make, Ms. Thiel?
So Chairman Peach and commissioners, in my time here, the only way that they have gotten pay increases is by someone bringing a motion. They do not qualify as regular benefited part-time employees because that's not the way that they're classified. They're kind of shared. So it's always had to come from the weed board's budget, and they come before us because we actually write the checks.
Okay, thank you very much.
And this is for 2021, correct?
For 2021. Okay. Any comments or any commissioners like to make a motion at this time?
Motion by Commissioner Falk to approve a 3% raise for the part-time employees at the weed board, which would be consistent with the county employees. Thank you.
Okay, there is a motion by Commissioner Falk. Is there a second?
I'll second.
A second by Ms. Knopf. Any discussion? If there's no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed? Motion is carried.
Thank you. I do have one final item. This is pertaining to our department, the State's Attorney's Office. As many of you are aware, we have an attorney that will be on a extended leave of absence in the spring of 2021. And so to help cover some of the work that individual will leave behind during his time away, I would request that we hire 2 interns to work in our office starting in January. Normally we do have 2 interns. Right now we do have 2 interns that work for the duration of the school year. So they work from May to the following April. So my request is that these interns be hired early. So they be hired in January of 2021 rather than May of 2021. So we would have an overlap of our interns for a while. So there will be 4 interns, but that would help us in covering some of the workload. I did confer with HR as well as Ms. Nelson's department, and there is sufficient room in our budget to cover the costs of 2 additional interns for this period.
Okay, thank you, Ms. Wamstead. What are the wishes of the commission?
Madam Chair, this is Dave. I move approval of the request.
Okay, there is a motion on the floor. Would someone like to second that motion?
I'll second the motion.
Okay, any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried.
Thank you very much. I have nothing further.
Okay, thank you very much, Ms. Wamstead. All right, then, committee reports. We're getting to the end, I promise. Mr. Falk, would you like to start?
Yes. First of all, Commissioner Ingen and I both attended the Local Government Advisory Committee on taxation issues, and we heard a presentation which will be presented to this board, I think sometime after the first of the year, involving 4 major projects. One in particular is very large, which would require tax increment financing bonds. Very positive news as far as construction, maybe not so much as far as taxation revenue for us in the first 10 years and even out to 20 on some of these projects, but these buildings will stand for a long time, much like trees do. More to come on that. And then the last thing is I want to talk about the Administrative Services Committee. I think this is the appropriate time that we just held a meeting on that. The request at that meeting, and I think all the commissioners were there, but for the record, the request was to pay employees in the recorder's office for vacation time that would be accrued over 240 hours and lost after the first of this year. And the committee indicated we would not do that. And we bring that to the board. At that time, I also indicated that I was concerned that they be given some time to burn off that vacation. And my proposal or my thoughts at that time was that they could carry over 80 hours to be burned by April 30th. And if they didn't use it by then it would be gone, but only carry 80 hours. I'm not set on 80 either. If somebody thinks 60 is more appropriate, that's fine too. But and some of it, I think our various commission members thought there was some management issues, which I didn't disagree with. But these are very difficult times. And since that meeting, then I had an opportunity to get in touch with our emergency management leader, who we all know. And she's one of those, and she has about 90 hours over, I believe, and one of her subordinates just under her has just less than those hours to burn. And I would maintain to you that the accumulation of those hours by those people is directly responsible to COVID and various other disaster issues that they've been facing. So I really think that there should be some time allowed for them to try and use some of it. And I know Kari, it's unlikely she'll use the 80 hours. If she gets 3 or 4 days, that might be it. But I think that we should show some good faith. And she did mention to me that she had talked earlier, and maybe to Mr. Ford, but I might be misquoting her, but that there should be some talk about this policy. And that was before this actually occurred, when major disasters occur, and how to deal with that. And so it's not the first that she's thought about this, but I think we need to be fair to them and try to show some good faith to our employees during this difficult time. Thank you, that's all.
Okay, so based on the Administrative Services report from Commissioner Falk, does anybody have any comments to make?
I just have a question of Commissioner Falk. When he's talking about extending that period out so that they have a period of time to use it, are you talking, sir, about all county employees that have gone over the 240 hours?
Yeah, exactly. I never thought this issue was just the county recorder's office. I would not deal with one office having a separate policy versus all the other departments. So my thoughts on this and is directly related to all departments. And they're going to have to manage this time and try to use some of it. And I fully believe that many of them will not use it up. They're pretty dedicated, a lot of these people. So.
Anybody else that would like to make a comment?
Madam Chair, Commissioner Falk, I'll just expand on Mr. Falk's comment about conversation with Kari Gels. Kari and I did have a brief conversation about the effect COVID has probably had on people's ability to take vacation. Yeah, Mr. Falk, Commissioner Falk, I think you're 100% right. Ms. Gels' excess hours are COVID related, just like Ms. Swanson's staff has been working 24/7, so it's Kari and her staff. But we've never faced something like this before. And so Kari and I, we did briefly discuss maybe, and I apologize, I have not had time to discuss this with Ms. Thiel yet or State's Attorney Lomstad, but maybe we're going to wind up rewriting the playbook when this is all said and done. So maybe this is a teachable moment where the county administration should bring something back to the board about, do we do something different with vacation in light of a pandemic of the magnitude of COVID? So that, I just wanted to clarify, that is the conversation. Mr. Falk, you're correct.
Okay, so we did have, there was a request made by the recorder's office asking for approval to extend their vacation hours and not lose them at the end of the year. And the Administrative Services Committee did not come up with a formal answer for her. Basically, there was kind of a no decision that was made to make a recommendation. So we still need a formal recommendation to go back to the recorder's office. And so at this point, we need some type of a motion to answer what the discussion that took place earlier today, what happened at that discussion, and to be able to formally answer the recorder's request. So at this point, I would ask for a motion.
Go ahead, Tom.
Go ahead, Dave.
Well, Madam Chair, I'm not sure we need to make a motion. Can't we table it to the first meeting in January?
I think they're going to
recover those hours because we do want to expand it to every office that fits. I don't know if we have enough information to decide what number, for example.
Madam Chair, members of the commission, I think it's really two issues. One is her request, and that's a payout.
Correct.
And so that, if you could take action on that one and then consider anything else.
Right, the payout request we need to identify now. And as far as tabling, looking at the policy and making some changes to the policy, that would be a separate issue that can be dealt with in 2021. We just need to have a final decision made on this request that came specifically from the recorder's office.
Madam Chair, I agree on the recorder's one, and I'll make a motion on that being it came out of our committee. But I think we need to deal with this other matter as soon as possible, and in essence tonight even. We can't let this drag on into 2021 for any length of time. This vacation time has to be used in the first 3 or 4 months in my mind, and that's really being generous, because we're only going to compound the issue because they're accruing more vacation. So if we wait a month or two to decide this, we're going to be talking in June when they're using it up and they're still accumulating more. So I'll let everybody think on that for a minute. I'll make a motion, first of all, to take care of the initial problem. I'll move that we deny the request to pay for vacation hours that were or are going to be accrued over and above 240 hours in the recorder's office as they request.
Okay, and is there a second?
What was the motion?
The motion was to deny the request of the recorder's office and not pay over the 240 hours for the recorder staff in the recorder's office.
Second the motion.
Okay, it has been moved and seconded. Any discussion? All in favor, say aye. Aye. Any opposed? Motion carries.
Thank you.
Okay, it has been moved and seconded. Any discussion? All in favor, say aye. Aye. Any opposed? Motion carries. Okay, it has been moved and seconded. Any discussion? If there's no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Opposed? Opposed? Same sign. The motion is carried. Okay, that was the committee report. Commissioner, I'm trying to move you up, Commissioner Hagan. Commissioner Hagan, do you have anything to report?
No, Tom spelled, or Commissioner Falk spelled out that taxing meeting very well. But we also attended a legislative Zoom put on by the Chamber of Commerce, talking about legislative priorities going forward, along the lines of what Mr. Ford presented to the commission last time. So that's all I've been involved in lately.
Okay, thank you very much. Commissioner Knopf.
I have a library board meeting tomorrow. I don't have anything to report on that tonight, but I bet I will next time. And I also have emergency management board meeting on the 4th. Or on the 4th, it's at 4 o'clock on the 21st, on Monday. So other than that, I don't have anything else.
Okay, Commissioner Ross.
We have planning and zoning, which we dealt with tonight, and then I have MPO tomorrow at noon. Commissioner or Chairman Peach, Mr. Falk, I think, was going to make another motion, wasn't he, about the months that person was going to have to use. Huh?
To roll over.
Yeah, to roll over, yeah. I mean, he wasn't done with his.
Yeah, I'll give him a chance. Don't worry.
Okay. Thank you. That's all I have.
Okay.
Thank you, Bob.
No problem, Tom.
All right. Let me finish with this one thought, and then I'll go back to you, Commissioner Falk. We were made aware on December 11th that the President of the United States had declared Christmas Eve as a holiday, just like Christmas Day is. And I guess I wanted to bring that up to find out if the building is going to be opened or not. If the building is closed, then the social services, we had a zone meeting today. And the zone employees that are state employees would have to work on Christmas Eve day unless we close the building, because then you have to follow the policies of the county. And so my question is, since it is a federal holiday, and it's a federal holiday like Christmas Day, the 25th, would the building be open or closed on the 24th?
Madam Chair, that is a holiday for us. The 24th, we would be closed.
Okay, so please inform Mr. Hoper that it is if he's not on, that it is a holiday that the building will be closed.
Yep.
There'll be a building closure day, meaning that the zone employees that are state employees, social services, would not work that day because the building is closed. Okay, thank you very much. All right, then back to you, Commissioner Falk.
Well, and I hate to belabor it because we're going long here, and I'm thinking of Commissioner Malm, who would be just ranting at me. Bless his soul. Anyway, I have some advantage in that I've talked with human resources about this also, and Michelle, and I don't know if she's still on the line. I hope she is, but she's here. Okay, great. But she's concerned, and she's kind of giving me impetus on this, but she's concerned about a snowball effect. Even when I was talking April 30th, that she thought that was a long date to go out, that's going to just exacerbate the amount of accumulated vacation time that some of these employees are going to have. And so that's where I came up with setting a short number, and maybe it should be the end of March, although I'm trying to get into April where maybe the weather would be a little nicer and they could burn a few days. And also the fact that we can't let them carry all of this over because it's just too much to get rid of in a 4-month period. And they have to accept some responsibility for not doing that during the past year. So I guess I'm going to make a motion that we allow the employees who are over 240 hours to carry 80 hours of that. So they could carry, what would that be, 320 hours over, but that the 80 hours has to be burned by April 30th or lose. And that would be for all employees and department heads, and only for this year.
Okay, so there has been a motion made by Commissioner Falk to extend and allow employees to carry an additional 80 hours over the 240. These hours, these additional 80 hours would have to be used or utilized or lost by April 30th of 2021. Does someone want to second that motion?
I'll second the motion for discussion purposes only.
Okay, the motion has been made and seconded, discussion.
So my question is if we allow these extra 80 hours to carry over until April 30th, April 15th, that employee quits. So they get their 240 hours, everything that they have earned per month, 16 hours a month through April, and plus the 80 hours that's carried over. We're going to pay them out for that. Yes, I know we have to, but I just want the commission to know what that means. And I get it's not an easy thing to say or to say that you know, you can't have your time, you know, that we don't appreciate what you did or, you know, the hours that you put in. But I get that. This is not an easy decision for us to make. And I'm discouraged in that we're just having to deal with that now. When we have 15 days left in this month, and we knew this many months ago, that this was, I mean, the department heads knew this, they know where we were going, and nothing was said. And now we're up against a wall. And so, you know, I just want the commission to know, I mean, there's lots of things that can happen as a result of this. And, but I also want you to know, I mean, we're talking 80 hours if they're carrying over, we're talking 240 hours that they can get paid for, and we're talking about any hours that they have earned between 1st of January and until they leave on, say, April 15th. And so I'm sorry, I have a hard time supporting it.
Okay, any other comments?
You know, I agree with Commissioner Knopf. She makes a very valid point on paying out on this, and maybe I'll throw this for discussion. Maybe I should add to the motion that 80 hours has to be used, but that we don't pay out on it. I'm not certain that we would have to pay out. I think almost all of these are senior employees, and I don't see them leaving us in the next 4 months.
I don't know how we can. I think that if we give them that 80 hours, we pay it.
Yeah.
I think we'll ask Michelle Thiel to step up to the microphone and give us a little direction.
Chairman Peach and commissioners, with the way North Dakota State wage and hour is, if the hours are accrued and available for them to use and they separate from employment, they have to be paid out. So there's a number of people on the spreadsheet where they would have 80 hours. There are a number of people on the spreadsheet who would have less than 80 hours. But what Commissioner Knopf had demonstrated or had said, you have somebody who has, they're capped at their 240, now we give them the additional 80 and they leave prior to April 30th, we would end up paying out the 320. And they also get 2 additional personal days starting in January.
Yeah, and so I mean, the chances of people even taking all this time off, I mean, because if they're almost gonna have to take a week a month. And in order to, well, to do the 80 hours, I guess that isn't a week a month, but it just opens a whole can of worms.
Okay, so we got that opinion that if this motion passes that, and they leave before they can use those additional 80 hours, they would be paid out for them. Any other comments that anyone would like to make? If not, I'm going to, when we do the motion, I'm going to do a roll call vote, just so I make sure that I can hear everybody correctly. So assuming a roll call vote, all those that are in favor of the motion, actually, I'll just do a roll call vote. Senators, I'm trying to make you commissioners, or senators. Commissioner Knopf, yay or nay?
Okay, so the motion was?
The motion was to approve an additional 80 hours to all county staff that have to be used prior to April 30th, right? Of 2021.
Oh, let's be careful on that. It's not all
Carry
staff.
forward. They
Yeah,
could carry
only the-
over an additional 80 hours from the previous year. They would have to be utilized those additional 80 hours prior to April 30th of 2021. Is that correct?
Over the 240.
Over the 240.
Yeah, it just applies to those that are exceeding the 240 limit.
Right, that is the motion. So Commissioner Knopf. Commissioner Ross. Commissioner Falk.
I could not hear either vote.
Oh, you didn't hear the vote?
Neither one.
Okay, Commissioner Knopf has voted no, nay. Commissioner Ross has voted no, nay. Commissioner Engen, what is your vote?
My vote is aye, for the reason that even though it could be expensive, we have to have a little good faith that they aren't going to just bail out and take us for a ride. And I think we should express some appreciation for the type of year they've had.
Okay, and Commissioner Falk, what is your vote?
Aye.
All right, so we have 2 for and 2 against, and my vote is nay. So the vote does not pass with a 3-2. Okay, anything else for committee reports? If not, we'll move into unfinished new business. The commissioner portfolio and the board assignments. In doing that, I've decided to leave them exactly the same as last year. The rationale for leaving the commission assignments the same as last year is that I felt the first couple of years when I started the commission, things changed so fast. It was very difficult to kind of get what was going on in those various assignments. And so it is my choice to leave them the same as they are. And they are listed on the screen as we speak. If any of you do have any concerns about the assignments that you currently have, please talk to me about that and we can address that. But that's what I've decided for this year. The 2021 County Board of Equalization.
Madam Chair, members of the commission, you have a letter here from the Director of Tax Equalization requesting that the board set the meeting for June 1st, wasn't it? Yeah, June 1st.
Tuesday, June 1st at 4 o'clock during our regular meeting. Do we need a motion on that?
Yes.
Okay, would someone like to make a motion that we have our Board of Equalization meeting at the first commission meeting on June 1st, 2021 at 4 p.m.
So moved.
Okay, it has been moved. Is there a second?
Second.
Okay, it's been,
Who made the second?
did you make that, Commissioner
Tom.
Fall?
Yeah, I'm sorry.
Yes, thank you. I don't think we need to have any discussion on that, assuming a roll call vote. All those in favor of the motion signify by saying aye.
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 Opposed? Motion carries.
Madam Chair,
Yes,
you move so quick and I'm getting tired and so I'm so slow.
that's okay.
But when we were talking about the committees, the
Yes,
boards, that
yes.
sort of thing that we sit on,
Yes.
I just want to point out that boards with terms, emergency management and library, and your emergency management, I am done the end of
Okay.
this month.
Okay,
Northeast Human Services, Commissioner Ross is done at the end of this month. And the library board, I will be done on 4/17. So I don't know what.
Madam Chair, she just did that. She
You're
reappointed you
reappointed.
and so there's no motion made. She as a chair appointed you, so your term now
You're
is
reappointed.
extended.
You carry another term.
That was still with the term. So
Yeah.
my
Yes.
term
Now it's 2 years greater.
2 more years.
Yes.
Yeah.
Yeah.
You can't get out of it that easily, Diane.
Very much, Diane.
What did you say, Tom? What did he say?
I said, Diane, you can't get out of it that easily. I'm kidding you.
Thank you.
And I apologize. Someday, Diane, you will have a decision for where the library is going to be. Someday.
Fiction or not.
Excellent.
So, fiction or not fiction, cute. Very cute. Okay, the commission meeting dates, that's just a notice?
No, Madam Chair,
Do we
members
have
of
to-
the commission, I need a motion to set the dates for the first and third Tuesday of every month. And I have those dates listed, but it is the first and third Tuesday of every month.
Okay, can I have a motion to set the
moved.
first, third Tuesday of every month for our commission meetings?
So
Dave,
moved.
you made that
Yeah.
motion?
Yeah.
Do I have a second?
Second.
It has been moved and seconded, assuming a roll call vote. All those in favor of the motion signify by saying aye.
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 Opposed? Motion is carried unless somebody wants to do it a different time, but nobody did, so wonderful. The Farms, 4G Farms lease agreement,
Madam Chair, members of the commission, this lease agreement has been in place since 2009 was the first year that it went in. 5 years. State's Attorney Welty drafted this lease. It's a piece of property that we took over for a hazard mitigation grant that was given to this property owner. We can note so that the property reverts to us, but we cannot never, ever sell it. So the only option for us is to lease it. We have leased it to this farmer who is the only farmer that would be able to take advantage of this piece. And it's $100 a year for each year. And I send him a bill for $100 each year.
so we need to approve this lease.
5-year lease. It used to be Gowans, now it's 4G Farms. Same thing.
Okay.
Gowans has a different name.
Okay, does somebody want to make a motion to approve this lease?
So moved.
Second,
I'll second.
okay, we have a motion and a second to approve this lease. I don't think there's any point of discussion. Assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Okay, opposed, same sign, motion is carried. We have no correspondence. Would somebody like to make a motion to adjourn the meeting?
Motion to adjourn.
Diane was quicker because she's now sitting in Commissioner Mom's chair. So Diane has made a motion to adjourn the meeting. Can I have a second?
Second.
All those in favor of the motion signify by saying aye.
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 Opposed.